Our next presenter is from the Shelby County Health Department. She is actually the director of the Shelby County Health Department. And if you live in Shelby County and watch the news, I'm quite sure you have seen her before. This is Dr. Alisa Haushalter, and she'll be discussing Shelby County opioid epidemic response and expected outcomes.
Thank you, Josh. And hopefully you can hear me at this point. I don't know what happened with the video, but you'll hear enough of me in the next hour or so. I do have a PowerPoint, so if you'll bear with me, I'll go ahead and share my screen. Thank you, everyone, for providing me with the opportunity to be here this afternoon. And it's also a blessing to get a break from COVID for a few minutes. So I really do appreciate the opportunity to be here. I always like to start with giving gratitude. 2020 has been unprecedented in many regards, and we all know that. But with that noted, I do want to take a minute to say thank you for providing me an opportunity to be here, providing me really a reminder of the importance of focusing on all of the issues that are affecting our community, not limited to COVID. And I want to particularly thank the Memphis Area Prevention Coalition for moving forward with this important summit at this time. It's easy to delay things given the pandemic, but it's important that we don't delay and that we focus on all of the things that we need to. So I want to say thank you. But I also want to say thank you to all of you for being here, particularly for those of you who have demonstrated resilience during this time, have remained committed to the issue of the opioid epidemic, and who have exercised a lot of creativity and aiming to continue to serve the public and serve your constituents during a very difficult time. And then I'm going to ask for a moment of digression, if you don't mind. This is also the year of the nurse. So 2020 is designated the International Year of the Nurse and Midwife. And as nurses, we celebrate the birth of Florence Nightingale. It's 200th anniversary of her birth. But as I've done many presentations these past few months, I've always reflected on the topic at hand and what is the importance and meaning of Nightingale in the current day. And her focus always was the center of nursing was caring. And as I prepared for the day, it was a good reminder of me of the importance for caring for everyone in our community and assuring that all people have an opportunity to be healthy. But also as a nurse and a public health nurse, we look to Lillian Wald, who is what is viewed as the mother of public health nursing in the United States. And since the beginning of the Henry Street settlement, Lillian Wald worked directly with people in communities where they lived, where they worked, where they played, and where they worshiped. But most importantly, what she did was focus on the root causes of illness, what we now call social determinants, and really carried forward a mantle of social justice. So both of them are serving to remind me of the importance of taking a public health approach to making sure that we focus on root causes and that we stay with issues for the long haul, as long as necessary to impact the change that we need to for a healthy community. I was asked to cover quite a few things today. I'm just going to highlight the big items. We've been at this as a larger group now for over 2 years, but we did engage formally with the University of Memphis to do an evaluation. So I was asked to specifically talk about the plan, a little bit about its origins, where we are currently. I won't spend as much time on successes because all of you are aware of those successes and were integral in making all of those successes happen. I want to talk specifically about the partnership with the University of Memphis, the evaluation that they conducted, and the recommendations that they made based on input from many of you. And at the end, I know there's opportunity for questions and answers, but I would also like that to be a time for you to provide feedback on where we need to go moving forward as we move into the next phase of this work. Many of you remember this early picture that we showed many times. Many of you have also used it. And this was used really for some years, but really beginning around 2017, 2018, a lot to educate the public on the growing issue of the opioid epidemic, to elevate it as a public health issue, but also to provoke action. So we've come a really long way since 2018 and since this initial slide that we use so often, but we still have a long way to go. This was an early iteration of the Tennessee Department of Health plan, which was developed and adopted in 2017. However, we recognized locally that we needed a plan that was a local plan, that any health issue really is quite different based on one community and compare that to the next community, so that we knew there was a need. And when I say we, it's the collective community, not the health department, to develop a plan that allowed us to address the opioid epidemic in Memphis, Shelby County, which is quite different than East Tennessee and many other places. Several of us had the opportunity to advocate directly to the county commission as well as Mayor Luttrell to ask for leadership in convening a task force to develop a local plan. So I want to just acknowledge that these are the individuals who were present during the initial phases. Commissioner Heidi Schaefer, who became chairwoman of the commission, really was the main convener of that group and propelled us to move forward with the development of plan in a very short period of time. This is a slide that Cynthia Nunley has used recently, and I think it's a great visual of how the plan has evolved over time. The task force was a smaller group. It was intended to really develop political will and advocate for county level resources to be invested so we could begin the work locally. Many of you are quite aware that while we had many deaths locally, our deaths and admissions were not anywhere as high as some other communities. So the likelihood we were going to receive local support was limited. So the need for county level investment was critical. And so that was the reason for having the task force and having it led by the county commission. But we knew that was not sufficient. And so then there was a broadening of who else needs to be at the table. What do others have in knowledge, experience, and skill that they can bring to the conversation so that we can all bring those talents to bear on this particular issue. From there, we moved towards working with many of you to form the work groups and continue the work and move that work forward. We have continued over time to reiterate the plan, which is what I'm going to talk about briefly. And by no means, as I said earlier, this work is not done. We still have quite a long way to go. This is an example of our very early plan. It's a strategy map, so it doesn't have all the detail, but clearly it mimicked the visual of the state plan, but it was an oversimplified plan and didn't cover all of the areas that we needed to cover. So over time, with input from many of you, a more comprehensive strategy map was developed. And from that initially were the 4 areas or pillars, as we call them: data usage and integration, prevention and education, treatment and recovery, first responders, and law enforcement. And over time, there was recognition that harm reduction needed to be its own pillar. And so harm reduction was added at a later point. I want to point out that at a foundation, we really all believe that compassion was critical to being able to serve our community relative to the opioid epidemic. We needed partnerships. We needed to strive for equity for all. We clearly needed to be innovative, but that not only would we need local resources, we would need to be able to garner national and state resources as well. From there, we have the updated driver diagram. So I'll be a little bit of an academic for a moment. A driver diagram is really those levers of change. So what are the things that are going to drive change over time? It's just a different representation of that strategy map. But I did want to include this because it does show how all of those interventions have grown over time and how the plan locally has become more and more comprehensive over time. And that's based on input and lessons learned from each of you, as well as other partners in the community that we serve. We did recognize within the health department that there was a need for a formal evaluation process. And that was for several reasons. One, we should always evaluate our work, and I think we all know that. I'd be preaching to the choir to say it otherwise. But for the health department specifically, we saw this as an opportunity to not only evaluate the plan, but also our ability as a health department to be of service to partners and to serve as a leader in addressing issues that historically we have not. And that through that evaluation process, we could also build our capabilities to be better partners and then address some of the other significant issues we have in our community, such as violence, trauma, and so on. I want to thank everyone who participated in the evaluation. The information was invaluable. And it will be the remainder of the presentation today and hopefully be the foundation for our conversations during the Q&A. There were a few key areas that we looked at, and I wanted to highlight those. We did ask specifically about leadership. We were assessing effectiveness or perceived effectiveness of the work groups, whether or not the goals were the appropriate goals given where we were in the epidemic. What were the accomplishments or perceived accomplishments by the group? What were the challenges or barriers to moving the work forward? Lessons learned, and then priorities for the future. So the evaluation covered 2018 and 2019, and specifically it addressed that period from probably mid-2018 through November of 2019. In June of 2019, the health department worked closely with the University of Memphis, and specifically Dr. Levy and Dr. Bartelli, who we partner with quite a bit, to develop an evaluation plan that we thought would help us from a quality improvement stance, move the work forward and continue to improve what we do. The study was conducted between June and November of 2019. And if I were you, I would say, well, we're almost in November of 2020, and this is a little bit late, but the reality is we all know COVID came in the midst of everything. And so while this may be later than we would have wanted to present it to you, I still think it's meaningful as we begin to explore how do we keep this work moving forward, knowing that COVID is going to be with us for some time. And I know there'll be some discussion tomorrow about the intersection of COVID and its impact on opioid overdoses and opioid overdose deaths as well. It was a mixed methods evaluation, so it included both quantitative and qualitative evaluation. We did go through the University of Memphis IRB, which this would be viewed as exempt, and so it was exempted through the IRB process. Just a few things on the data collection specifically. There was a survey that was sent out to work group members, as well as health department staff, as well as political leaders and other leaders that were engaged from the beginning. Within that survey, there was also 4 open-ended questions, which was one component of the qualitative data. There were additional focus groups that were held, as well as key informant interviews. And the key informant interviews were a good broad representation of all participants, but a heavy emphasis on the political officials. In part, we wanted to get a better understanding of how to build political will to continue the work moving forward. There was additional data collected, and that was through minutes and notes from the meeting, sign-in sheets to look at engagement, as well as the milestone reports, and then any of the products that were produced, including the media products or communication products. So what I wanted to do next was share recommendations that were brought forth from the University of Memphis, and then after that, open it up for discussion, questions and answers, but specifically what resonates with you based on the recommendations that are listed, knowing that this was completed last year Probably the report was finished more towards January, and how we can continue to move forward, but where are there some other gaps that we need to fill in based on another year's worth of work. So one of the key recommendations was to prioritize treatment, specifically to expand access to treatment beds, and especially for treatment beds where there's medication-assisted treatment available. To establish an electronic intake and referral process to identify beds that are currently available. To consider novel approaches such as neighborhood treatment centers and expand peer navigators. What I'm going to add here, because I know that the work began to move forward after this report, was actually to explore the possibility of expanding MAT in 201 Poplar as well as the Corrections Center. The other recommendation was to expand the task force partnership to specifically have more involvement from the medical community, the faith community. There was a lot of comments on engaging more with the faith community, to have greater representation from school leaders, the mental health community, as well as the business community. Another recommendation was to validate the efficacy of the stop events. We know that those have been well received, but there was also a thought if we could measure the impact of those particular events, that could be used to garner additional resources for moving the work forward, but for specific community organizations and treatment facilities. The other was to invest in technical assistance, one for health department team members, but also for task force members. And some key areas that came up was project management, the implementation of continuous quality improvement in this work specifically, the ability to translate and use data. And I would just add to that, it's not just the use of data, but really using data to drive change and to continue to drive change over time. Social marketing, and then use of media more broadly. So as we look at next steps, we know that we all have a role to play in some way or another. I will recommit what I actually said in the video earlier that you didn't hear, is that I do recommit. We've been committed all along, but I think as the health department leader, it's especially apropos that I say we are committed to this work over time. We have obviously dedicated local resources so that we're not dependent on grants, and we will continue to dedicate those resources moving forward. But also many of you have roles to play that will help us continue to address the opioid epidemic locally. It is important that we also continue to address this as a public health issue, and that we know public health issues, there's no quick fix. We have to be committed over time, but also over time to get to root causes. And once we get through some of those critical in our face things that we need to deal with, then how do we peel the layers back and continue to address those social determinants of health, or those root causes that lead people towards substance use disorder in the beginning. And that specifically is trauma, but not limited to trauma. Also, there's a need for resources, human resources, as well as financial resources. And then also to continue with partnerships, knowing that because of COVID, many of us have been impacted in our ability to do work and serve our community. And so how do we continue to do that given where we are with the current pandemic? So I'm going to end with a song here, although I'm not singing it, nor am I going to play it. But from the words of the song, where do we go from here? And for me, I think that's the fundamental purpose of this session, is based on what we all know we've done well so far, areas that we could improve, information that we received from the University of Memphis on areas to focus. I really would like to open it up and ask you for your insights on, one, the evaluation, whether or not there are key things that resonated with you, and then your ideas on where we would go from here. So I'm going to turn it back over to the moderator, and Josh, I'm assuming that's you for questions.
That is me. And remember, everybody, your questions, please use the Q&A on that's built into Zoom to ask your questions. And also, I'm going to put the link to the evaluation in the chat. And you'll remember to click on that link and you'll fill out the evaluation, and then you will get additional links to the certification that you need. That will either be continuing education credits or a attendance certificate.
And Josh, we can make the PowerPoint available so that people have that list as well.
Right. Okay, first question. Is there a plan to implement investment into juvenile correction and to specifically Hope Academy to provide impactful resources to children and young adults going through the program?
So I would say from our end, many of you know inmate health falls under the purview of the health department. One of the things that we are doing, one is exploring MAT within 201 Poplar and corrections. We would also then be looking at juvenile. And then we currently have an RFQ out on the street, as we would say, that has to do with inmate health services, but specifically within that is expanded mental health services. So there would be some resources there. But if there are additional ideas on things that we can do locally with the juvenile justice system, please email me. I'm happy to have a conversation. We work closely with the juvenile justice system, but also work with community services and other organizations that provide services as well.
Thank you. Anybody else have any questions? Well, this is the director of your health department here. I know
you can ask me about COVID. You can ask me about anything. But specifically, I would like feedback on what else we need to be doing as a collective group to address opioids, or things that specifically the health department can do as well.
How has COVID affected the opioid crisis?
So it's interesting because we all know that the number of overdoses has gone up, fatal and non-fatal. In the end of June, we had a CDC and White House team that came to visit Shelby County. We were one of 10 communities that were visited by the White House team. And the purpose of their visit really was about COVID. It was specifically to help us reduce our number of cases. There was a thought that Shelby County really was at a pivotal point, and with the right interventions, we would reduce transmission. But we did take advantage of Dr. Merman, who was the lead epidemiologist, and he's an assistant surgeon general. Most of his career has been in the HIV arena, but he also has extensive experience in the opioid epidemic. So we did ask his opinion around our overdoses and whether or not he thought that there was a direct correlation or connection to COVID. And it was interesting. His response was that he had actually looked at our data prior to coming to Shelby County, and that he believed our numbers were already going up as before COVID. So I think we need to recognize that we were having challenges in part because fentanyl was hitting the market very heavily, and then COVID hit at the same time. So there was impact from COVID, there's still impact, but that's not the sole reason that we've had increases in overdoses locally. Where I do think there's been significant impact, and I know David's going to talk about some of this tomorrow, does have to do with our ability to provide services, because so many essential services, while they were open, many people were working from home. There was attempts to try to reduce the likelihood of COVID transmission. So I do wonder if we have been able to provide the level of services to people, particularly those who may not be in a treatment facility or may be experiencing homelessness and need more outreach, and whether or not we've been able to service that community fully during the COVID pandemic. So that was a long answer to a short question.
All right, next question from Miss Gina. Has the COVID-19 virus made recovery more challenging, and has the drug of choice changed at all?
Now, I'll be honest, I don't have as much information on that from my end, and I apologize. There may be others who have more information relative to that. What I would be able to say to you is that for any inhalant that somebody might use, so if they're smoking any substance whatsoever, that is actually going to increase the likelihood that they would become, one, infected with COVID, but also more likely to be ill with COVID. We know smoking alone, cigarettes has an impact there. Vaping has an impact there. And so there can be worsening of illness for someone who uses inhalants, but also if somebody is already run down because they're not eating well and really further along in their substance use disorder where they may not be physically healthy, then they're more likely to have complications as a result of COVID. We don't have data from the hospitals on patients who may have been admitted with COVID who also had substance use disorder. I'm going to make a note because that's a question I'm probably going to ask the next time we meet with the hospital systems to see if there was a specific increase in admissions within that population.
Yeah, and we have been seeing a lot more meth use out on the streets now, where it's just straight meth and no opioids involved as well. T-Lane has a question. Are there any specific education plans implemented for opioid use in elementary and high schools?
We don't have any here at the health department, but I will write that down. I know that's been a big push by many work group members in the past, is to do more work within the school system and particularly elementary schools. I know there's been some efforts in that regard, but those actually can be beefed up, I'm sure, considerably. With children out of school, it's probably a little bit more difficult to integrate that into the regular educational routine.
Okay, and I have another question. Are you aware at this time if schools or universities are going to be opening next semester?
So the plans now from Shelby County Schools is to look to open in January. They have a list of criteria, or we would call them gating criteria or triggers, that they would like to meet before they can open. That was recently published in the Commercial Appeal. So if you want to Google, you can get the exact numbers, but it has to do with the number of cases, new cases per day. It has to do with hospitalization capacity and one other item, but very similar to the 4 gating criteria we always use, which is number of cases, rates of cases, that's all within the cases. We look at hospital capacity, testing capacity, and public health capacity. Universities are already open. Some of them have combination learning, some are all on campus, and then some are distance. And then the municipal schools are also open, Catholic schools are open, and some of the independent schools are open already. I would assume your next question is, do we have more cases as a result of schools opening? We have had outbreaks at the, but that's been specifically related to athletics. We know contact sports is high risk for transmission. We also know that any kind of contact sport, not just football, but football is specifically high risk for COVID. And so that there's been an outbreak there related to two sports as well as cheerleading. And then we've had an outbreak at one of the high schools that also was related to football. So while we've had cases in the schools, we can't say that opening the schools has increased our COVID pandemic significantly in Shelby County.
Okay, and the next question actually is related to this. Has the closure of schools affected substance abuse in Shelby County? So are you seeing correlation with school closings and an increase in substance use?
So what I would say is that nationally, there's a projection that we would see increased substance abuse. We would also see likely increased child abuse. Locally, we do not have the numbers to confirm that. There are organizations, obviously, that are collecting data, but I think it's too early to say there's a direct correlation. One of the things I do want to point out, because we've looked at a lot of the negative impacts of closures. I want to say it was Yale recently, but I can find the study and share it with Brianna to send out to the group. Actually said that fathers are reporting improved relationships with their children because they're spending more time with their children because of COVID. So there are some positives that are coming out of this as well.
Okay, and so Catherine Meyer Jones says, I work with treatment providers across the state, and I often wonder if a broad racial disparity in substance use treatment is to blame for a historic lack of options for treatment in Shelby County. How is the health department targeting Hispanic and Black communities to provide education on treatment options, particularly on medication-assisted treatment?
That is a great question. And I would say it's, with other things, we can probably do much more in that area. I would say as a public health department, we really strive to make sure we're getting the message to all people and then trying to deliver that message in a meaningful way for that community. But no matter what we do, we always have room for improvement. So I will definitely follow up to see if there's other things we can do, particularly in the Latino community and in communities of color. But there are some other things that have happened and that I think the COVID pandemic has prompted the conversation. Many of you may be aware that the county commission did pass a resolution that racism is a pandemic. The city of Memphis followed with an ordinance indicating that racism is a pandemic. The importance of that is that by elevating it politically, it allows us to say we must do more in this area to address historic inequities and the systems issues that perpetuate those inequities over time. So exploring with the county commission, what are all the things we can do as a health department to be supportive of those efforts. But I think that's a great time to say we've got to do things differently so that all people, and particularly communities of color in Shelby County, can receive treatment that they need, can access health care that they need, can achieve educational attainment, and so on.
Okay. Christine Bouchard asks, what aspect do you think needs the most help or volunteers immediately? Where should someone start in their efforts to help with the epidemic?
So I think at the current time, there's still a lot of need in education and outreach and continued work in the treatment arena, particularly as we look at how do we advocate for access for all people and to expand MAT within the community. I would like to see more medical providers get engaged. Clearly, we are moving forward within the health department to do more within the jail and correctional settings, but also input there. So I think it's really based on what people's interests are and what their talents are, or their discipline and profession are. But again, education as well as treatment. And then we're also hiring people. So, we need people with data analysis skills, either as employees or volunteers, and that is part of the data integration group.
Well, that's good to know. Uh, Elder Bear asks, can the health department do more PR on presumptive Medicaid for women who are pregnant and have an addiction and need medical coverage?
Yes, we can. That's pretty simple. Many of you know you can sign up for presumptive Medicaid if you're pregnant here. And I will follow up with our team to see what we can do in addition to what we're already doing. One, to get the information out, but also to make sure that if people come here to sign up for eligibility, that we're providing them services in a caring environment. So that's a great question.
Another question, I'm not sure if this is in your wheelhouse or not. It's Dennis McGowan. How has COVID impacted in-house treatment centers, and how are they dealing with the clients that tested positive, and are they still admitted?
It'll depend on the facility. Every facility is a little bit different when it comes in the treatment arena. Nursing homes, it's pretty rote in what they'll do or not do if someone tests positive. Many of the treatment facilities are going to wait until the person is out of their isolation period to be able to admit them. However, sometimes a person can be admitted to a hospital bed or some other location until they're able to go into the treatment facility. So yes, COVID is impacting any place that people receive care, including treatment facilities, not just inpatient, but group and so on. And we just have to recognize that is part of the fallout of COVID. We do want to encourage people to still get tested and still go for treatment if they need treatment. As a health department, many people are not aware, when we place someone in isolation, we have a responsibility to assist them to meet their basic needs. So there has been a few circumstances where people needed treatment either for mental health disorder or some other condition, where we have temporarily housed them in a hotel until they could get into the facility once they were out of isolation.
Right. All right, and someone's asking if are there any volunteer opportunities with the health department regarding the opioid crisis?
The volunteer opportunities really would be through the work groups. And so reaching out through Shelby TN Health and letting us know you're interested, and we can get you connected to a work group. I would say if somebody has a specific area that they wanted to volunteer, I would explore how that would look. We've used a lot of volunteers through COVID, which is something we don't do frequently. And so I think we're better equipped now if somebody actually want to volunteer in the health department itself to explore what that might look like.
And the work groups you're referring to, prevention and education, treatment and recovery, law enforcement, the
data integration and harm reduction.
Right. Okay. Making sure.
You probably thought I couldn't list them off.
Yes, I'm actually the chair for prevention and education, and we would love to have volunteers and people come attend the meetings. And we're actually working on getting into high schools and elementary schools now to provide some education for prevention purposes.
Well, thanks for the update on that one.
Mm-hmm. All right, Isabella Frere says, I feel as a young adult, I was never really aware of opioids. Now knowing I have many friends addicted. I went to a private school and I feel they shelter their community from certain problems. And I would suggest stressing the importance of talking about this problem. So more of a statement than a question.
Yeah, I would just kind of add to that. It's one, a responsibility of schools, but it's also a responsibility of families as well as other leaders in the community. I really have this same talk with my children as they were younger. It's part of a health conversation. These are issues that people face. There are things that they may be exposed to, decisions they have to make, but also we all know there are genetic predispositions for certain things. And so really destigmatizing the conversation and having parents talk about it. Pediatricians should be talking about it as part of well exams, and then schools in addition to that, so that it's a more normalized conversation and that people are accustomed to it, and then can, one, ask questions, but also seek help when they may need help.
Okay, a couple of more COVID questions. Are you ready for these?
Sure.
All right, I'm gonna kind of put these into one question. Do you think it's safe to open the schools back up with the numbers increasing? How safe is it for the kids to actually attend in January? And is the COVID vaccine going to be required?
Okay, I'm gonna try to answer all of them. If I miss one, just let me know.
Sure.
The Shelby County School specifically will not open in January if the numbers are not down. So while the plan is to open in January and have a combination of virtual and in class, if the numbers remain high, they will not open. For the municipal schools, and this is by executive order of the governor, the school districts are able to make their own decision to open. Our role as a health department is to provide them data to make sound decisions, and we do that. To provide technical assistance, we do that as well. And then to work with them if they have cases or outbreaks. So at the current time, as I said earlier, we don't see an increase in our epidemic or pandemic as a result of schools opening. So we're quite comfortable at the current time with schools opening. Whether or not they're safe, that is an informed decision that fundamentally parents and caregivers need to make based on their own child. So there are standards from the Centers for Disease Control as well as from the American Academy of Pediatrics. I can tell you all of the schools locally are using those guidelines with technical assistance from us to create as safe an environment as possible. But there are some children that may have illnesses, pre-existing conditions, chronic illnesses that may make them specifically at risk. And if that's the case, a parent may opt not to send their child to school. Also, children do have to wear masks at school. And so there are some children who also may have challenges wearing the mask. They may have sensory issues that make it problematic for them to wear the mask. And again, that's a decision a parent would have to make. But in general, I believe that our schools are doing everything they can to create a safe environment. They're working closely with us if they have a case to contain it. And so I'm comfortable with where we are. Shelby County, again, we'll see when January comes what the numbers look like. The vaccine specifically, while we were preparing to administer vaccine locally, we're recruiting providers to help administer vaccine. It is a wait and see to determine at the federal level when the vaccine is approved, and then when it's approved, who is able to actually get the vaccine. So I encourage people to stay current on information about the vaccine, and you can go to Shelby TN Health, but you can also go to the Centers for Disease Control website for information on the vaccine specifically.
Thank you. Okay, and this, back to the opioid epidemic.
Okay.
And this is a great question. Do you know how and if the Memphis area has been affected by dealers using pill presses to make substances look like pharmacy grade pills? And I'm assuming fentanyl is what we're probably referring to here.
Yeah, so I always own my limitations. I'm a healthcare person, not law enforcement. So I actually don't know if there's been increases in pill presses and the impact of that. There may be somebody else in the group from a law enforcement perspective that has more detail on that than I do. So I apologize.
I actually can't answer that. And the answer is yes. We have been seeing pills pressed in from fentanyl into the shape of other pills. And they're actually, the counterfeits are getting very, very realistic. Some of them, you can't tell the difference. We just had several overdoses in Martin, Tennessee, where Percocets were pressed from fentanyl. So they are definitely finding their way around the state. And jumping back to COVID, I guess we'll probably have time. I don't think we'll be able to get to all of these. We have time for about 3 or 4 more. Do you anticipate an end to COVID anytime soon? If so, what does that look like? And what would the best case scenario be?
So I have told people repeatedly, this is a marathon. We do not anticipate an end to COVID until well into next year, and that's even with the vaccine. So we're really encouraging people as much as possible to think for the long haul. We know it's challenging. It really has impacted people in many ways, and I don't want to underestimate that at all. But it is important that we prepare to wear masks well into 2021, if not all the way through 2021, to continue to social distance. And when I say social distance, it's not just the 6 feet across from each other. It is limiting your travel. It's limiting how many people you're around, really making, I'll say, diligent decisions about what you do. I use myself as an example. I go to Nashville a lot. I have a large family, a lot of grandchildren, a lot of children, but I don't visit everybody in the same day. If I go one weekend, it's my mother. If I go 2 weeks later and I wait a whole 2 weeks, then I go visit my son and all his children. Then I might wait 2 weeks and go visit another son and all his children. So that thinking through that, so that you reduce the likelihood of not only being exposed to people, but if you yourself have COVID, the likelihood you're going to give it to a lot of people is limited. But do plan to be thinking well into 2021. And if we end the pandemic, what it would look like is that we either have no cases or very few cases or something similar to seasonal flu. But we can't even tell at this time when that might happen.
Right. So basically you're saying it's up to us, that we have to pull together and all do the right thing, and we can end it sooner than it would.
Really, our numbers are starting to go back up. They were going down. Most everything is opened up with the exception of adult entertainment venues right now. And so we really are focusing heavily on individual and family choice, and specifically masking, social distancing, good hand washing. We looked at some data recently, and about 70% of people who had COVID did have symptoms. But then of that same group of people, the total number of 500, about 65% of people still went out and did things when they weren't feeling well. So I keep reminding everybody, we've all had the cold at some point. We've all had flu at some point. There's that day where you say, I just don't feel like myself. Mm-hmm. When you have that feeling, that's when you stay home. Sure. And that's also going to help reduce the spread. But as you said, Josh, it's up to us at this point to do everything we can to reduce the spread.
Absolutely. All right, another question about COVID. Has there been more infant deaths from COVID?
No. We have had a youth die who was, young teens, but really we've had limited deaths amongst children here locally. Children tend to not be as sick as adults. There have been nationwide some infant deaths, but not locally here.
Okay. All right, last question, and this is the jackpot. It contains the opioid crisis and COVID.
Okay.
So we're firing on all cylinders here. What is or can be done to protect individuals directly affected by the opioid crisis from COVID, such as the homeless population and individuals with no resources or transportation?
So one of the things that I can say Shelby County has done really well in its COVID response through the Joint Task Force, a great deal of resources has been put into various agencies that serve people who are experiencing homelessness, those who may be in need of food, and then the distribution of masks has been done by many. So Community Services Agency has focused very heavily on assisting those who may be experiencing homelessness for whatever the need may be, whether it's temporary housing, whether it's transitional housing. And then we've done extensive outreach, we being the health department, but others. We received about 750,000 masks from the state of Tennessee, and those have all been distributed within the community to reduce transmission. There's been other efforts to get out hand washing materials and so on and so forth. And then there's been some limited screening efforts in a few areas. And then one of the things that, again, is very Shelby County specific, anyone can get tested for COVID regardless of insurance status, and they're not charged for that. So that's another way to quickly identify if somebody does get COVID, so that we can get them into a safe place for their recovery from COVID. and making sure they have enough food to eat, clothes, and so on and so forth while they're ill.
Well, thank you, Dr. Haushalter. We know you are very busy. So thank you for taking this time to join us and to give us all this great information.